Good evening, Aspen fam. All right. Well, when I was around 11 or 12, my little brother and I decided to build the fastest snow sled ever. Our parents had just bought this large deep freezer, so we had this big brown cardboard box, and we got to work. We cut out the top, and we created some skis. And then we decided we probably need to lift it up to get down the steep, snowy, covered hill in our backyard. So we spent a little bit of time on struts. We started making the struts to lift up the sled. We spent the bulk of our time on what we thought would really make our sled race ready, using Mr. Sketch markers to make it all styled up. You know, the type you'd pop off the cap and take a long, deep sniff? My favorite was always blueberry. Well, as anyone who's gone sledding could predict, our amateur design and engineering didn't hold up so well. We hit that first bump, the struts collapsed, our sled was no more. So, why am I telling you a story about a failed cardboard sled? Well, I was at a talk on early childhood systems several years ago, and the speaker said something that really stuck with me. She said, we need to build equity into the walls, not just the wallpaper. And this idea of examining the core of our systems, the walls of our house, the struts of our sled, and focusing racial and health equity is what's guided my work as a physician and healthcare systems leader ever since. Yet we aren't building a cardboard sled from scratch. Our healthcare system needs reconstruction. And as we rebuild, we also need to reconstruct our ideas of what progress towards racial and health equity looks like. Over 115 years ago, sociologist and civil rights leader W.E.B. Du Bois talked about the impact of structural racism and social drivers of health on the health and well-being of Black Americans. In his 1906 report on the health and physique of the American Negro, he put forth recommendations and proposals that were based in community education and focused outreach. Unfortunately, the leaders at the time did not heed his call. 75 years later, the Institute of Medicine put out a report on, 75 years later, the Institute of Medicine put out a report on healthcare in the context of civil rights. Their report did detail those persistent health inequities and gaps, and they either directly or indirectly pointed towards, their quote, the medical care decisions of minority community members. Thank you. A lot of their recommendations reflected this belief. They called for more research, more data, more reports, more wallpaper and markers to dress up racial health disparities. 22 years later, the Institute of Medicine put out another report, 2003's Unequal Treatment. This time, they did call out the history of racial segregation, of healthcare systems policies, and of bias in providers and stereotyping in providers that significantly impacted healthcare outcomes. They once again put forth proposals and solutions, but however, they, like the 1981 report, missed out a vital component that W.E.B. Du Bois had talked about nearly a century ago: community voice. There was no sections in the report that focused on what communities experiencing health inequities thought was the path forward, let alone ideas on how we get there. So placing blame on our communities that are experiencing health inequities without giving them the opportunity to seek input, without following their lead, this is what has contributed to the health disparities that we see today and continue. And it's a way to dodge accountability. And it's created a disconnect between our healthcare policies, our public health policies and payment, and the priorities of Black, American Indian, and other communities of color. It's supported a healthcare system that's not really broken, but it's doing what it's been designed to do: allocate resources to maintain a racist status quo. Medicaid is part of that system, a significant part in Minnesota and around the country. That's why at Minnesota Medicaid, we are working to reconstruct health equity by building racial equity into the walls of our Medicaid program. This iterative process is recentering our conversations, our policy priorities, and our actions on the ideas of communities most impacted by structural racism. And the good news is it's starting to work. Our first Building Racial Equity into the Walls of Minnesota Medicaid report, focused on and done in collaboration with our US-born Black community members, is already transforming care in Minnesota. And it's leading to conversations around the country about how this community-guided approach, the policies it creates, can help guide Medicaid policy across the country. And it's also clear that policies that come from advancing community-centered priorities will positively impact everyone. By focusing on communities most impacted by structural racism, we don't find a zero-sum game. In Minnesota, we've succeeded in extending continuous coverage to all children enrolled in Medicaid. We've increased investment in community-based resources like enrollment navigators. And we've helped advance long-sought policies like increasing reimbursement for doulas. Recognizing that our communities are not monolithic and that we need to seek a greater depth of perspective and ideas. And as a step towards true accountability, we are committed to showing up over and over and over again. We're already in the middle of our next community-guided report, working with our sovereign tribal nations, American Indian community members, to help further develop our health equity priorities. In 1935, W.E.B. Du Bois wrote in Black Reconstruction that rule following, legal precedence, and political consistency are not more important than right, justice, and plain common sense. So, as government agencies, as private sector and nonprofit organizations, we must ask ourselves, is the blueprint we are following to reconstruct our healthcare system just, or are we just covering the cracks with wallpaper? Reconstructing a just, equitable healthcare system will be uncomfortable. It will be disruptive. It will require trust and collaboration. My brother helped me build a sled and got in it at the top of a hill because he trusted me and I trusted him. We were accountable to each other. My communities in Minnesota are doing the same thing as we work to build racial equity in Medicaid. So as we think about how we can reconstruct health equity, let us lead with love for all our communities, accountability to them and each other, and let us make sure that we are focused as much on the struts, more so than the scented markers. Thank you.